I saw a patient today. This patient has had amputation of the right leg, and unfortunately, the left leg has started developing wound. It is important that I come and discuss this important topic with you. You see, diabetes has a lot of complications, and one of the complications is diabetic foot when you have wound on your leg, and this may lead to amputation. Every 30 seconds, the leg of a diabetes patient is amputated, which is a serious problem. Apart from accidents, one of the things that leads to amputation of the legs is diabetes. So it is important that you know the steps you need to take to prevent amputation. Because once your leg is amputated, that will affect your productivity and also your social life. So how do you prevent terrible complications of diabetes? You need to know the do's and don'ts of how to take care of your feet, because it's from that care that you exempt yourself from developing these complications. Let's start by discussing the don'ts. It is important that you do not walk barefooted as a diabetes patient, because that places you at risk of different kind of injury. I have a patient who stepped on a needle without knowing, because already he has developed neuropathy. So he didn't know that he stepped on a nail. It was after 3-4 days they noticed that the leg is becoming swollen and started discharging fluid, that they realized that he actually stepped on a nail, and that led to fever and serious infection. It took serious effort from the health personnel to save that foot from amputation. So you can see it is important not to walk barefooted. It's also important not to wear tight-fitted shoes or heels. Decrease blood supply to the leg, and once there's limited blood supply to the leg, it prones you to injury. It's also important not to wear tight-fitted stockings, because it will also limit the amount of blood that flows to the leg. When you're cutting your nails, it's important that you do not use razor blade or anything that is sharp, because that prones you to minor injuries. And if your blood sugar is not good, that minor injury can be a point of entry for bacteria or other microorganisms that will cause serious infections that may lead you to losing your leg. So it is important that you do not use that. It is important that you don't always keep your food wet, because if your food is always wet, there's high risk of a particular microorganism we call fungus that will cause this kind of food here that will later lead to serious infections. Keep your feet dry. It is important that you do not apply cream in between your toes, because that will also make the leg wet and fungus will grow and cause serious infections. But all this I have said are the don'ts. How about the things that you should be doing? It is important that every single day you should inspect your feet. Check everywhere. If you cannot see, you can use a mirror or ask someone to help you check your feet every single day. If you notice any wound, any swelling, please contact your doctor and seek for assistance. It is important also, I earlier said that you should not wear tight-fitted shoes. So your shoes should be well fitted. It should not be tight and it should not be oversized, because if it is oversized, you can easily trip off and fall down and you may develop some injuries. Okay, so it is also important that your socks should not be tight. If possible, it should be pure cotton socks that is not tight. Avoid wearing heels. Very important. When you're cutting your nails, please use a nail cutter, because it's highly unlikely to cause any injury than when you're using razor blade. It is also very important that whenever you use water, use a clean towel to clean your feet thoroughly, because it is important that your feet is dry to avoid microorganisms to grow. Apart from these ones that I've mentioned, one of the most important ways to keep your leg away from infections and eventual amputation is to control your blood sugar, control your blood pressure, do not smoke, and control cholesterol. If you do these things, no matter what, it will be very difficult for you to experience amputation, because you are taking the necessary steps to keep your legs healthy and to keep your legs going.